Hi, this is Dr. Barry Horowitz, one of the co-directors of the Metabolic Research Institute in West Palm Beach, Florida. When patients come in to participate in a clinical research study, they oftentimes have questions about the research process itself. One of the questions we often get is, can a clinical research study be dangerous for me? Another question we get asked is, if I do not want to participate in the study anymore, once I've enrolled, can I quit? So I'm going to answer the second question first. When a patient comes to participate in a clinical research study, they sign what is called an informed consent. This is a form that tells the patient very clearly what to expect in the clinical research study, and it tells them in depth about the medication that's being studied. It also goes into both the potential benefits and risks for participating in that study. Now, when they sign that document and enroll in a clinical study, it's not like they're signing their name in blood to the devil. A patient can, at any time, for any reason, without any question or repercussion, stop participating in a clinical research study. Now, of course, we as the investigators prefer that patients complete the study for the scientific aspects of it, but again, for any reason, a patient can stop at any time. Now, going back to the first question, which is, can a clinical research study be dangerous? It's important to understand that most of the time, the medications that we are studying are not yet approved by the Food and Drug Administration, and if they are, they might be being studied for another potential indication of that medication. So that is the point of doing a clinical research study, to make sure that the medication is both effective and safe for humans for the indication that the drug will have. Now, there are 4 phases of a clinical research study. At the Metabolic Research Institute, we usually participate in later phase studies, phases 3 and 4, and sometimes in phase 2. What that means is by the time we are participating in the clinical research study, the medication in question has already been studied to a certain degree in humans, and we have a good sense as to the potential benefits and side effects of the medication. And again, that is clearly communicated to a patient so they can make an informed decision at the beginning of the study when they read the informed consent. The other thing that's important to understand is that during the clinical research study, a patient is very carefully watched. When they come in for visits, we speak with them. At certain intervals, they have physical exams. At certain intervals, they have lab tests, so that we can make sure that they're doing well and that there aren't any adverse events to the medication. And speaking of adverse events, if an adverse event were to occur, anything from a common cold to something as serious as cancer or a heart attack, we look at that and we decide if that might have been due to the medication, so that the research company that's studying the drug and the Food and Drug Administration can know about it. And we as investigators get letters from the research company letting us know of other adverse events that have happened to patients in the study. So again, when you come in to participate in a clinical research study, you read the informed consent and you can decide whether it's something that you think would be beneficial after knowing all the potential risks. And doing a clinical study, you are very clearly and carefully watched, as well as we watch from other sites what is going on with the medication, and we inform patients of that as soon as we know. I hope this answered the questions about the clinical research process. And if there's any further questions or you'd like more clarification, you can give us a call at area code 561-802-3060. You can also go to our website, which is www.metabolic-institute.com. You can also go to the FDA website, which can answer other questions about clinical research studies.